Well, in this week's Cardiology Countdown, we have incidence of heart failure with breast cancer chemotherapy. Also a look at sodium restriction and the new recommendations from the AHA, and great news about lipid profiles that they don't need to be fasting. So starting off is a study that looked at over 45,000 patients in the Medicare database and women with breast cancer who had received one of the new biologic agents, Trastuzumab, either with or without anthracycline, and looked at the 1, 2, and 3-year incidence of heart failure or new diagnosis of cardiomyopathy. And in this older population, the rates were pretty high. So they identified about 20 events per 100 patient years in patients receiving these agents. And so it's a reminder, this has been published, but one that we need to broaden a little bit the agents we worry about in terms of LV dysfunction and cancer therapies. Next up is an AHA presidential advisory talking about salt and hypertension, something we've known about for a decade. My father studied 50 years ago, and one where some new studies have reaffirmed the benefits of lowering sodium intake as a key way to improve hypertension and cardiovascular outcomes. In this new AHA presidential statement, they cite new experimental data that have shown reductions in ventricular hypertrophy and perivascular fibrosis of coronary arteries, interestingly, in animal models. Also, many observational studies linking dietary sodium and cardiovascular outcomes, and new meta-analyses that have looked at studies of lower versus standard sodium intake with reductions in cardiovascular outcomes. And so all of these reaffirm the recommendation that one aim for less than 1,500 milligrams per day in total sodium intake with various foods. I think colleagues and my mentor in nephrology have pointed out that processed foods are the biggest offender here, and so looking at the labels is a way to get our patients and ourselves to reduce sodium intake. And hopefully food companies will take this on as a new way to try and make food healthier. And the top pick this week is a new study looking at whether or not you have to be fasting for your lipid profile that we have many patients get at their annual review. This was a study published that looked at Calgary-based laboratory values that had the time of duration of fasting available. And it found no correlation with total cholesterol, HDL, or then the calculated LDL, less so. Triglycerides differed in those who had fasting versus non-fasting samples by about 20%, but that wasn't really that relevant to most patients. And so a recommendation can emerge from this, and the two editorialists both noted that in addition to the authors arguing that it may be just fine to have patients have their lipid profiles non-fasting, with the exception of patients that have hypertriglyceridemia, where a fasting sample would be still very important to have. And so good news to simplify care in managing lipids. So for this week's Cardiology Countdown, I'm Chris Cannon.